MoCA Practice Test 2026 Montreal Cognitive Assessment, Full Course Visuospatial Executive. Question 1. What is the first task in the Visuospatial/Executive section? Clock drawing, alternating trail making, cube copying, animal naming. The alternating trail making, 1A-2B, is usually first. Question 2. How many points is the alternating trail making task worth? 1, 2, 3, 5. It is worth 1 point if completed perfectly. Question 3. What is the correct sequence for the alternating trail making task? 1-2-3-4-5 A B C D E 1 A 2 B 3 C 4 D 5 E 1 B 2 C 3 D. The pattern alternates between numbers and letters in ascending order. Question 4. In the cube copy task, how many points are awarded for a correct drawing? 1, 2, 3, 5. The cube copy is worth 1 point. Question 5. What are the criteria for a correct cube copy? 3-dimensional. All lines present. No extra lines, lines relatively parallel. All of the above. The cube must be 3D, have all lines, and show proper perspective. Question 6. How many points is the clock drawing task worth in total? 1, 3, 5, 10. The clock drawing task is worth 3 points, contour, numbers, hands. Question 7. What are the 3 components of the clock drawing score? Size, color, time. Contour, numbers, hands. Shape, numbers, pointers. Circle, text, accuracy. 1 point each for contour, numbers, and hands. Question 8. What specific time must be set on the clock? 10 past 11. 11:10 4 o'clock. 1:50. The patient is asked to set the time to 10 past 11, 11:10. Question 9. In clock drawing, what constitutes a correct numbers point? All numbers 1 to 12 present. Correct order and placement. No extra numbers. All of the above. Numbers must be in order, in the correct quadrants, and no extras. Question 10. In clock drawing, what constitutes a correct hands point? 2 hands present. Correct time indicated. Hour hand shorter than minute hand. All of the above. Hands must show 11:10, and the hour hand must be noticeably shorter. Question 11. What is the maximum total score for the Visuospatial/Executive section? 3, 5. 7, 10. Trail, 1, plus cube, 1, plus clock, 3, equals 5 points. Question 12. If a patient draws a clock but swaps the hour and minute hands, how many points do they lose? 1, hands. 2, hands and numbers. 3, 0. They lose the hands point only. Question 13. In the alternating trail making, what happens if the patient makes one error and corrects it immediately? 1 point. 0 points. 0.5 points. 2 points. Any error that is not immediately corrected or even a self-corrected error, depending on strictness, usually any deviation, results in 0. Question 14. If a patient's cube is 2D instead of 3D, do they get the point? Yes. No. Maybe. If it's need. It must be 3-dimensional. Question 15. What should the examiner say if the patient asks where do I start, on the trail making task? At number 1. At letter A, anywhere you like. I can't tell you. The instructions state to start at 1. Question 16. What is the purpose of the alternating trail making task? To test memory. To test set shifting/executive function. To test motor skills. To test vision. It tests the ability to shift between cognitive sets, numbers and letters. Question 17. If the clock contour is a bit oval rather than a perfect circle, do they get the point? Yes. No. Depends on size. Only if it is perfect. The contour must be a circle with only minor imperfections, slight leakage is okay. Question 18. In the cube task, if the lines don't touch at the corners, do they get the point? Yes. No. If they are close. Depends on examiner. Lines must meet at the corners for a point. Question 19. Why is 11:10 used in the clock drawing test? It's an easy time. It involves both upper quadrants. It tests the neglect often seen in stroke. Both B and C. It requires processing of both visual fields and inhibits the 11 vs 10 confusion. Question 20. Is the examiner allowed to use a ruler for the cube copy? Yes. No. Only if the patient asks. Only for the patient. The drawing must be freehand.